Hi, everyone, and welcome to today's webinar. My name is Paul Adepoju, and I'm the AHCJ's Global Health Crisis Reporting Forum's community manager. And we are glad to be talking about these issues that are actually at the core of whether the COVID-19 vaccination exercise in different parts of the world would be successful or not. The scientists have done their part by making the vaccines available. It's now left to the rest of the world to actually decide whether to take this vaccine or not. And we've seen that vaccine hesitancy has been a highly polarized subject with different perspectives and people contributing, having their own say on different issues. But as journalists that we're expected to bring the news, the facts to the people, we often find ourselves struggling with or unable to accurately convey the truth about this. And that's why we have an expert with us today, an independent journalist, Tara, who will be helping us to expatiate on what we are supposed to know. Hi, Tara, how are you doing today?
I'm doing well. Glad to be here.
I would like to start with Tara's presentation, then I'll come back with the interactive session. So Tara, you can start sharing your screen and take it from here.
All right, will do. Hi, everybody. I don't know what time it is where everyone is. I imagine it's different everywhere. It's in the morning here, so I was just getting my kids ready. Hopefully they don't come in and interrupt me. They're doing school at home at the moment. Can you see this okay? Does that look good? Let's see. Does that look good, Paul? Okay. I assume it will be, and if you're not, you'll interrupt me. Thank you for coming to this. I've been reporting on vaccines for about 11 years. I'm pretty passionate about it, and I will be going through this. There's a lot of information in here. I apologize in advance because I'm going to try not to go super fast through these, but I'm going to provide the slides to Paul so that he can distribute them to you, so that if you want to refer back to things later, you can do that. But let's go ahead and get going. First, just general comments right at the start. Good vaccine reporting requires a lot of homework. It took me years to learn a lot of the things that I'll be sharing here. And it took me years to just be familiar enough with the science of vaccines to be able to report effectively on them. So I always recommend reading other reporters who are very good at reporting on vaccines. And I have a list of folks here. These are reporters that I read on vaccines, and I've seen very good work from them. So now this is a very US centric list. The only one on here who's not in the US, I believe, is Hilda Bastian. She's in Australia. So there are definitely plenty of great vaccine reporters that are not on this list outside of the United States, but I tend to follow more of the US news at the moment and know more of the US reporters. So those are some folks to check out. I actually would be interested later on if you guys want to send me some people that you think are really good in vaccine reporting in your countries. I'd love to know so that I can expand my reading. So just an overview of some common pitfalls in reporting on vaccines. One of the big ones is false balance. That is, not all attitudes and beliefs are created equal in science. It's similar. One of the examples that I give is if you were going to report on the Holocaust, this is not science, it's history, but if you were going to report on the Holocaust, you would not include someone who denies that the Holocaust exists because that's not factual. Like, it just flat out isn't true. So you want to keep in mind when you're reporting on vaccines, there can be disagreements and those need to be covered. But there's a difference between disagreements between scientists that are reasonable and based on the evidence and people who flat out deny the evidence exists entirely. So you want to be real careful about making sure that you don't make someone who doesn't believe the evidence at all is on par. It's like someone saying that climate change is not happening. Okay, climate change is happening, and it's very clearly happening due to humans, including our country and many others. So you wouldn't include that in an article about climate change because that's not what the evidence supports. Using the wrong experts is a big one. Making sure that you're choosing correct experts, making oversimplified assumptions about vaccine beliefs, behaviors, motives, the reasons that people do things. Relying only on debunking. I have deficit model there in parentheses, and I'll be mentioning that later. The deficit model it's a psychological or social psychology concept that says you've got a deficit of information in your head. And if you're simply given good information, then poof, you'll do the right thing. And if that were true, we wouldn't have anybody smoking. Everybody would be slender and healthy, and we would have no wars, right? Clearly, that's not what happens. It's not a matter of just giving people good information and then they suddenly do the right thing. So you can't rely only on just giving them the facts. You have to do more than give people facts. On the other hand, there are some people who say that debunking never works. They say, oh, there's no point, you shouldn't bother because people are just never going to believe it anyway. And that's not true either. So it's, somewhere in between. Not covering vaccine weaknesses, risks, or concerns is a problem. I don't know enough about the reporting overseas, but here in the United States, there was a period where people were not covering risks of vaccines because they were afraid to. And that was a problem because there are risks associated with vaccines, even if they're very, very, very small. Usually, journalists have a responsibility to cover all aspects of vaccines. Not understanding the social psychology and the cognitive biases as they relate to vaccines. So, hesitancy is not just people being stubborn and not, wanting to be, inconsiderate or uncompassionate or unempathetic or selfish. There's all kinds of different reasons that people make the decisions they do when it comes to vaccines. And so you have to kind of understand all of the different things that are contributing to those decisions. And then neglecting the differences across communities and demographics. I am sure that you have seen reporting from people outside of your country about your country, and they get things wrong, right? Because they don't live there. They don't know the differences between different groups. So that can happen even within a country with your own populations. So tips for reporting responsibly on them, starting with use the appropriate sources. So seek out people who are experts specifically in infectious disease vaccines and or vaccine hesitancy. So a vaccine expert is not necessarily a vaccine hesitancy expert. A vaccine hesitancy expert is not necessarily a vaccine expert. You want to get as precise as you can, as long as they're available. I mean, sometimes you can't get the best experts that you want, but you try. So, if you're reporting on the development of a vaccine, talk to someone who works in vaccine development, not just a doctor or someone who distributes vaccines, for example. If you're talking about vaccine safety, don't just talk to people who specialize in vaccine effectiveness, talk to people who specialize in studying vaccine safety. If you're reporting on the COVID-19 vaccine, you want to talk to people who have experience reporting on respiratory viruses or coronaviruses. On the other hand, there's great work happening right now on the malaria vaccine. If you're going to be reporting on that, someone who reports on coronaviruses or studies coronaviruses is not going to be the best person to consult for a parasite like malaria is. So you want to make sure you're finding the right people to ask the questions of. Where to find them? I use PubMed a lot because it basically has all of the studies that are published in the English language and some other languages. I'm not sure all of which ones, but it's a great place to look to see what papers people have done. I also look at other news stories and who other good vaccine reporters are using. I also reach out to universities. I look at their experts pages, or I talk to their departments and find out who's doing the research there. University media relations can be really helpful in this way. I also encourage people to seek diverse sources. Now, what diverse means in your country will be very different than what it means in mine. Here in the United States, that means for me, mostly making sure I talk to lots of women and specifically trying to reach out to Black and Hispanic people because they are underrepresented. Now, what that means in your countries is going to vary, but you probably know who's not represented as much in the news as they ought to be. So look for people who might have diverse perspectives, especially within the research community. Avoid just using sort of like the local doctor or the local nurse or a researcher who is, maybe they're a microbiologist, but they don't specialize in vaccines. So, unless that's your only option, you want to try and get the people who actually study the specific area you're covering. Understand the difference between efficacy and effectiveness when you're looking at the studies. Efficacy is how well a vaccine works in clinical trials, whereas the effectiveness is how well it works in the real world. Effectiveness can also depend on how many total people are vaccinated in a population, because a vaccine is going to be less effective if fewer people are vaccinated. Keep in mind that 95% effectiveness does not mean that 5% of people will definitely get sick. It depends on their exposures. It means that there's a 95% reduction in sickness. So if you have 100 people here and 100 people here, and you expose both of them to the virus, and one of them is vaccinated, one's not, in that situation, you should see all, if 100 sick people in the non-vaccine group get sick, then 95 of the people over here will not get sick. Okay, only 5 will. And keep in mind that efficacy and effectiveness they can refer to infection, they can refer to disease, severe disease, hospitalization, death. There's different ways to measure that. And I apologize if some of you guys know these. I go over these basics all the time because I don't always know where people are at with this, but infection is the virus being able to enter the cells and begin replication. Disease are the symptoms of the infection, often caused in part by the immune response. So infection and disease are separate things. Most vaccines do not actually prevent infection. All vaccines prevent disease, that's the point of them, but a lot of vaccines do not prevent infection. The measles vaccine usually does, but not all do. A vaccine that prevents disease but does not prevent infection can lead to asymptomatic transmission. And we're actually seeing that right now in the United States with Delta. The COVID vaccines that are used here, the mRNA ones, were originally thought to stop transmission, and they did with the previous variants. When Delta came along, we discovered that it no longer prevented infection, and now we have vaccinated people who can be carriers. And then vaccines, you probably already know this, they can reduce transmission 2 ways: herd immunity, sterilizing immunity. Sterilizing immunity means not, preventing infection. Reporting on adverse events. So when you have adverse events, you've got to be transparent and straightforward. Keep in mind that most adverse events are caused by the immune system reacting. I mean, that's what vaccines are trying to do. They're trying to get a reaction from the immune system. Distinguish between mild, moderate, and severe, and make sure that your audience understands what those terms mean, because that's where a lot of the fear comes in, if people don't understand those differences. Avoid reporting on every single adverse event, even major ones. Whenever you start a new rollout of a program, you're going to see a lot of adverse events initially because it's going to catch people's attention. You want to look instead for the patterns, especially since you have to know whether or not those adverse events were actually side effects. Not all adverse events are side effects. Adverse events are anything bad that happens after you get the vaccine. Side effects are things that happen because of the vaccine, that it's definitely related to it. If you do have exceptional things happen, if a person does die or get really severe reaction, put it into context. Help people understand, like, how likely is it for this to happen? Did this person have an underlying condition, or is 1 out of 1 million people going to have this kind of reaction? And make sure you compare the risk of the adverse events with the risk of similar symptoms for the disease. It's really easy for people to say, oh, well, I don't want to take the risk of getting the vaccine because of those adverse events. But not getting the vaccine will have a risk as well if it's available to them, because then they have the risk of all the things that can happen if they get the disease. And people often forget that either way, getting the vaccine or not getting the vaccine is a risk. It's a choice. Anytime there are deaths after a vaccination, investigate them carefully before you report on them. Make sure it's clear whether it was actually caused by the vaccine, and they usually won't know right away. It usually takes time to figure that out. And avoid sensationalizing, which I'm sure you guys already do that. These are just some examples of headlines that we have here in the States. 2 of these were mine, where we talked about weaknesses related to vaccines. Fear of needles can stop people from wanting to get vaccines, or, when people overestimate a vaccine's effectiveness. So be careful of, going too, you don't want to be like a vaccine champion. You want to be a journalist who's accurately covering what people need to know. Breakthrough cases. These are cases where you have an infection after a vaccination. No vaccine is 100% effective, just like no vaccine is 100% safe. Nothing is. You have to put those breakthrough cases in context, but you also can't assume the denominators. So, for example, in the United States on April 26th, there were 9,245 reported cases that were breakthrough cases. And at that point in time, about 95 million people were fully vaccinated. You can't just put 9245 on top of 95 million and assume that's the rate of infections. because there's probably a lot of people out there who have asymptomatic infections or didn't report their infections. So you got to be careful about making assumptions about what you can actually report. And also pay attention to severity and asymptomatic disease. We have a lot of infections right now from Delta in the United States, but we have far less death than we would have if we did not have as many people here vaccinated. I'm going to skip this because you can read this later, and you guys probably already do this using analogies and metaphors to explain. I will emphasize, though, that you want to put numbers in context. It's really easy for big numbers to get lost and become abstract for people. And a lot of people struggle with percentages. So 1 in a blank is a lot easier for people to understand. 1 in 1,000 people, 1 in 1,000,000 people, 1 in 5 people. That's a lot easier because people can think, okay, I know 5 people. And one of them is going to have this happen to them, or my village is, it has 1,000 people in it, and 1 in 1,000 is 1 person. Vetting studies. When you're looking at studies, make sure that if it's a controversial or surprising result, check that author's past work and experience, and make sure you talk to other researchers. Is everything kosher here? Is everything here look right? Has it been peer reviewed, or is it a preprint where it's not been peer reviewed, it's just been put out there before it's gone through the peer review process? Who funded it? What kinds of funding have the scientists who did it also taken from elsewhere? Do the scientists who did it have any kind of ideological bias? Do their past studies show that they kind of have an idea ahead of time of what they believe? What's the quality of the journal that it was in? And these are kind of things you guys would know as science journalists anyway. What were the pre-planned endpoints? Is that what they reported on, or they report on some other part of the study? So pay attention to statistical power and statistical significance and limitations of the study, and always think about the findings in the context of what we already know. There is an existing evidence base, and you want to think, okay, how do these findings fit into the big evidence base that we know? And that's a really good question to ask your outside sources when you talk to scientists. Tell me what these findings mean in light of what we already know with everything else right now. No science happens in a vacuum. Headlines. Work with editors if you can to try and get thoughtful and accurate headlines. You want your readers to have the key information. A lot of readers never read past the headlines, all that wonderful work that we put into writing these wonderful stories, and they don't even read it. The headlines also should, they should convey the main finding, but they shouldn't overstate it, exaggerate it, understate it. You want to try and keep them accurate. It's tempting to try and get them to, click on the story to read the whole thing. But if that many people are only reading the headline, you want to make sure the headline is good. With photos, avoid real big close-ups of needles, wincing faces, tears, ominous images, excessive drama, cropping people's head off at the top where you just see their arm, because it's an overly dramatic image. You want to use accurate needles that are the right size, or use needle alternatives. And I'll give some examples here in a minute. You don't have to have a needle in every vaccine photo. Make sure you can see the whole person, or at least from their whole torso, for example. Pay attention to how you frame your findings. So these are some examples that were in the United States back last spring. 99.992% of fully vaccinated people have dodged COVID, CDC data shows. That's not necessary. That was true, but it wasn't true. That was one of those ones where they literally just took the number and they divided by 95 million. That may be accurate. It may not. And yet the next one isn't that much helpful. So far, 5,800 fully vaccinated people have caught COVID anyway. Well, just using that word anyway makes it sound like it was pointless, which, 5,800 is not very many. So, it's more important to be precise. This third one here about breakthrough infections being rare is good, but we don't know what extremely rare means. And then they give it to us in the subhead. So that gives us an idea, less than 0.1%. That's actually more measured, okay? Or you just give straight up like 5,800 Americans, and then you say it in the story. So think about how you're conveying that information. Similarly, compare these two. We've got breakthrough COVID death, fully vaccinated Flossmoor man, 75, dies from virus a month after second vaccine dose. Okay, if it was only a month after his second vaccine dose, he may have caught COVID before his body even responded fully to that second dose. So, this kind of implies that the virus was worthless to him. Whereas this bottom one, state reports small number of breakthrough COVID-19 cases in fully vaccinated Alaskans, is a little bit more measured. So it's going to vary. But if it is the case that it didn't help him, well, let's look and see. Did he have underlying conditions? When was he diagnosed? Think about those things when you're actually putting together that headline. If you have option, not everyone has control over the headline. So this is an example of an image to avoid, and you may or may not have control over the photos, but if you can talk to your editors about it, try and avoid the big needles or super big close-ups. These are a little bit better, but even these feel a little bit over dramatic sometimes. I prefer these kinds of photos where you actually have, real people getting the shot, and the shot is a small portion of the whole picture. Or these where it's, scientists or doctors who are working with it, and it's a little bit more, just more realistic. It's not so dramatic with the other ones. And these are examples of images that convey vaccine without actually having a shot in them. You can also have Band-Aids, on people's arms, or, there's lots of ways to convey vaccine that are not just a needle. Avoiding false balance. So I talked about what this was in the beginning. Not all things are created equal. Legitimate debate may exist. It very often does in science, and it deserves coverage when it does. But you want to make sure you know what the actual scientific questions and disagreements are among the actual experts, the people who really know what they're talking about. And then you want to offer context to those dissenting viewpoints. How many scientists agree with this side? How many with that side? Is there a third side or a fourth side? Are there people who are in between? If you do have to include someone who is, for example, an anti-vaccine activist or is vaccine hesitant, make sure you put that in context. How many people feel that way? Are there any doctors who agree with them, or do 99.9% of doctors disagree with them? Make sure it's clear what the evidence shows when you're sharing that information. Pay attention to who gets the most quotes. It's really easy when you're talking to some people, maybe the scientist you're talking to is not super quotable. Maybe they don't sound all exciting. And you talk to someone who's really hesitant and they have a really colorful quote. They're very, engaging. If you give lots of quotes to them, your story is going to lean heavily toward conveying that feeling to the reader, even if that's not what you want. So think about how many, who's getting the most quotes, and who's getting the first quote, and who's getting the last quote, right? Who gets the last word in your story? That's really important. Do you want your last word to be someone who's not getting a vaccine that has been otherwise proven to be safe and effective? That's not a great place to leave your people, your readers. Don't forget all the other issues that are involved with vaccines. And this is more of a problem, I think, in the West than it is for the global South and a lot of middle and lower income countries, because you guys know, that logistics of vaccine distribution are not simple. There are shortages that happen. There are challenges along the cold chain. It's important to know who is distributing the vaccines and who should be distributing them. Are they being distributed near government offices or at schools or places of worship? Are there people who won't go and get the vaccine because they're only at government offices? Here in the United States, we have a very large undocumented immigrant population, and they're very frightened about going near government offices. If you put a vaccine center next to, for example, an immigration enforcement office, they're not going to get a vaccine. I wouldn't blame them, right? Who wants to go there? They're terrified. Pay attention to the income of neighborhoods. Another problem here in the United States is the higher incomes, the neighborhoods with higher income have more vaccine centers. And you'll find inner city areas where there's no pharmacy for like 15 miles because it's a low income area. So don't conflate hesitancy with a lack of access. A lot of people may not have access, and access is not just being able to it's not just having a vaccine around the corner from you. Access also means having access to information to help you understand the vaccine. It means having the ability to take off work if you're going to have side effects. You might want the vaccine. You might trust the vaccine. You might be able to walk to get the vaccine. But if you have to work every single day and having side effects for one day means your kids aren't watched, you don't have childcare, that's not access, right? So you want to make sure you don't, that's not hesitancy, that's lack of access. When you're reporting on hesitancy, familiarize yourself with the medical research. It's very different than vaccines. You don't want to make assumptions. People are often surprised when they start getting into the research to see why people don't do vaccines. And there's a lot of reasons. There's not one, there's tons of reasons. And be careful about the term anti-vaxxer versus vaccine refuser versus vaccine hesitant, right? A person who's vaccine hesitant is not an anti-vaxxer, which is like, these anti-vaccine advocates who are out there with the signs chanting and going on TV and telling people not to get a vaccine. Try to understand the demographics of vaccine hesitancy, why some groups are concerned. Are there certain religious minority groups that have concerns? And what are those concerns? And why are they there? Are they valid? Avoid worsening political divisions or other social fissures that already exist. You'll know where the fault lines are in your community. So try not to make those worse than they already are. Keep in mind that vaccine acceptance is a continuum. It's not like you're for or against. There's people that are all the way along that, like, maybe, I don't know, so keep that in mind. Keep in mind that vaccine hesitancy surveys and polls, when you say, like, 17% of all Nigerians want blah, blah, blah. Okay, was that actually a peer-reviewed study, or was that some random guy who called 1,000 people on the phone randomly, right? Was that a WhatsApp, survey that he sent to his friends? Make sure that, the surveys and the polls you're reporting on come from people who know how to actually record vaccine hesitancy. There are several issues when you ask someone if they want to get a vaccine. There's social desirability bias. They might answer either the way they think the interviewer wants them to answer, or the way they think their colleagues might. So, for example, here in the United States, there's a higher proportion of people who voted for Trump who don't want to get the vaccine. And if you ask them if they want to get the vaccine, they might say no, because they want to be thought of as someone who would not get the vaccine because they're someone who voted for Trump, but they might have actually gotten the vaccine. So you got to, you need interviewers who actually, know those things. Keep in mind that someone's attitude toward vaccines is different than their intention to get it, which is different than their behavior. My dad was all like, I don't know about these vaccines, man. They're all like, Bill Gates is putting a chip in it and all. Okay, as soon as the vaccine was available, he was first in line. All right. So he had a bad attitude about the vaccines, and he pretended like he wasn't going to get it. But dude, as soon as that was available, he was in line. So, just because someone says something doesn't mean that that's actually what they're going to do. The wording in these surveys often matters a lot. And keep in mind, this is something a lot of people forget. Vaccination works on social norms. If all your friends are getting the vaccine, you're going to want to get the vaccine. If none of your friends are getting the vaccine, you probably are going to be less likely to get the vaccine. If you read an article about how, 90% of your group, whatever your group is, don't want the vaccine, you may have just dissuaded the other 10% from wanting to get it now. So think about that when you're doing your headlines and you're reporting on this. We are social creatures, and our peer pressure affects all of us. So reporting large numbers of vaccine hesitant, you have to be honest, right? You can't hide the truth or hide the numbers, but you want to be careful about how you convey those numbers, right? Especially if there's different gradations along the way. A couple of myths about quote unquote anti-vaxxers, which is also, this can go for vaccine hesitant and vaccine refusing people. Shaming does not change health behaviors. It doesn't. Like, repeat that to yourself over and over. Shaming does not change health behaviors. We have so much evidence showing this is the case. The anti-vaccine movement has existed since the first vaccine, and has been growing and shrinking over time, right? It's been kind of like going up and down over time. We're at kind of a higher point right now in the United States, but it's not new. Vaccine myths are a lot like actual myths, right? There's common threads. If you've ever studied mythology across the world, there's a flood myth in every single, in almost all cultures. There are creation myths in almost all cultures, okay? Vaccine myths will often originate from our fears and insecurities. A common one, for example, is fear of infertility. You will see that come up over and over and over with all kinds of vaccines in all kinds of countries. So, keep that in mind. Also keep in mind that those who don't vaccinate, they're a very diverse group, politically, economically, socially, educationally, cognitively, racially, religiously. There's all different kinds of, it's very rare that you have just one group that won't vaccinate and everybody else will. That doesn't usually happen. Okay. And most people who are not vaccinated, they also do fear the disease. They just fear the vaccines more. Okay. So, a lot of this is them having trouble with that risk calculation. And non-vaccinating people are often very intelligent, very well educated, and very well informed. You can't assume that if they are concerned about vaccines, that they are not necessarily well informed. They might be. In some cases, there might be cultural beliefs that stop people from vaccinating. Be cautious not to disrespect those. If you have, for example, someone who is Muslim and they have a concern that the vaccine contains animal products, especially if it's a pork animal product like gelatin, you need to be honest about that and understand, okay, is there a way that we can, are there people in the religious community who can discuss whether it's appropriate for them to get this vaccine despite that, right? Instead of just saying, oh, that's no big deal, you should just get it anyway. Be honest. I mean, we're journalists, we do this anyway, but I say that because Julie Lees, she's an Australian researcher who's really great in this area. If you're overconfident about vaccine risk communication, when there's uncertainty, you'll lose people's trust. They're not going to trust you because they know it's uncertain. So you got to be honest about what you know and what you don't know. Okay. You have to recognize when and why mistrust might occur for reasonable reasons. Like if you have a population that has had lack of access to healthcare or other services, they can't get their kid taken care of when their kid's really sick. And then you show up in that village and you're like, okay, I'm going to give everybody a shot. And they're like, well, we don't even have clean drinking water and you're trying to stick stuff in our arms. There's a good reason for them to be suspicious of that, right? Because why do you suddenly care about sticking them with a vaccine when you weren't even helping them get clean drinking water? So, think about the reasons that people might have that distrust, and try and discuss the underlying reasons for either that distrust or for the myth. With that example I gave of infertility, this was the story. I wrote this 6 years ago. It was about an infertility fear related to the Tdap vaccine. And I dug back and found out why that actually existed. And there was an actual vaccine tested in like phase 1 trials like 30 years ago for birth control. It never got used. It never made it out of trials. But there was this tiny kernel of truth that was being used and the Catholic Church knew about that. And there was a lot of fear. So, trying to get to the heart of an issue so you can explain where it's coming from, that gives you more credibility. When you are debunking misconceptions, again, using just the deficit model, just giving people facts, it's rarely effective on its own. Try and give stories, right? We all learn through stories. All of our myths and our faiths and our family practices that are handed down are all based on stories. So, your story, you're a journalist, you're storytellers. Check out, there's a book called, you can download for free online, it's by Stephen Lewandowski, The Debunker Handbook 2020. This is a fantastic resource, and it goes over a lot of the research on debunking. Be careful of big articles that list like every single possible myth about a vaccine, right? Or misconception. First of all, if you go through every single one, it can backfire, where people are like, they're like, oh, no, I believe it anyway. You can also, the Streisand effect, you can Google that and see what that is if you're not familiar with that term. But basically, if there's like 3 people who think that getting this vaccine is going to turn them into the Incredible Hulk, you don't need to put on your big article that's going out to 1 million people, the vaccine does not turn you into the Incredible Hulk, because nobody was thinking that except for those 3 crazy people. And now you just gave 1 million people the idea that maybe it does turn them into the Incredible Hulk. Okay. So, don't include every single possible thing that you can find, because you might give people ideas that they didn't even think about. They were like, well, dang, I never thought about that. If you write opinion pieces and op-eds, keep a neutral tone. Don't be snarky or mock or shame or superior. Those do not help. That shaming, again. When you're myth busting, when you're addressing misconceptions, avoid stating the misconception and then correcting it, because you might reinforce what it was. So, for example, these are examples from my own writing before I learned this. Okay, the first one's from 2013. The flu vaccine gives you the flu or makes you sick. That's not true. The problem is I just reinforced it by saying that. So instead, use questions or affirmative statements. Can getting the flu vaccine give you the flu or make you sick? Fact, the flu shot can't give you the flu. Okay. So you want all of your declarative sentences to say the accurate information. Recognize anti-vaccine dog whistles. Okay, I don't know if dog whistles is an idiom. I don't know if that's used in other. I don't know if you're familiar with that idiom. A dog whistle is where you You use terms that let people know how you feel without explicitly saying it out loud, just like a dog whistles like under the, the dog can hear it, but other people can't. So these are some of those terms. I'm not anti-vaccine, I'm pro-safe vaccines. I'm pro-parent choice. People should have a choice of what they put in their bodies. Young and healthy people won't die from COVID-19. The truth about vaccines, boy, truth is a loaded word. This is what they won't tell you. Vaccines are unnatural. Vaccines are full of chemicals. So these are all common things that you see these should be giant red flags, basically. Okay. And what happens is if you don't know not to use them, you do what this guy did. This is a New York Times column by David Leonhardt. And I tore this guy to shreds on Twitter because of this. One of his sentences said, now a version of the mask story is repeating itself, this time involving vaccines. Once again, the experts don't seem to trust the public to hear the full truth. This guy was pro-vaccine. He was trying to say that we're underselling the vaccines. We're not giving them enough credit. But he used words that appealed to anti-vaccine people because he wasn't familiar with those terms. And so he fell into the trap of using their own language because he wasn't educated on this issue. So that's why it matters. Keep in mind that you win people over with hearts and minds. We've known this for years. Doctors tend to be the #1 trusted authority in vaccine, even among the hesitant people in the United States. That's based on US research. I don't know if that's true in other places. I know when I did a project down in Mozambique back in 2014, there were certain communities where the religious shamans were much more trusted than everyone else. And so doctors and shamans, they partnered together. And the doctors would work with the shaman. The shaman would actually, do different kinds of ceremonies and would carry out the faith-based practices, but they were giving accurate information with the doctor. So it depends on who they trust. And so this is a US-centered slide. You need to find out in your own area, who are their family and friends, their community, who are the trusted messengers? Who do they trust? That's really important to know. And always put things in context. I can't repeat this enough. Give the information surrounding something. That's the most important part. So we will stop there. And I will stop sharing my screen here and answer questions. I know it's a lot.
Oh yeah, it's a lot. And you rightly said, everything has to be put in the right context. And when you were presenting, I was just taking note of many of the key issues that you mentioned. And so let's start on a very light note. Do you think reporting vaccine hesitancy requires journalists to go beyond conventional journalism, how it used to be practiced?
I do. I think our first, the first thought, the conventional journalism approach would be, I'm going to go to this community and talk to someone who doesn't want the vaccine and ask them why. There's some value to that. That's, your initial reporting, but you have to go much deeper than that. Once you hear, they might give you the reasons they say they're not getting the vaccine, but there might be underlying reasons that they themselves aren't even aware of why they're not getting it. They might say, I'm afraid of blah, 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 when really they have a different fear that they're not even conscious of. So you have to talk to experts who can look at that. And I'm not saying people don't know what they do and don't want, but we've all had the experience ourselves where we think we want one thing and then we find out later, well, okay, I didn't actually, that was not what I wanted after all. I just didn't realize it. So you need to talk to diverse people and be real careful of, there's a lot of examples of this in the United States that drive me crazy. They go to that one crazy guy that voted for Trump and they stick the microphone in his face. He's like, I'm not going to get this vaccine. Nope, you can't make me. You give me $1 million, I'm going to take that vaccine. Okay, there's a lot of people you give $1 million, they're going to get that vaccine. That guy's not like your representative guy. Okay. You want to talk to people who are truly representative of how other people in that community are feeling, and recognize again that there are differences in the community. Here in the United States, just as an example, there are some people who fear that the vaccine is just going to give them nasty side effects right away. There are people who fear long-term side effects far off in the future. There are people who fear that it just won't work. Why bother if it just won't work? There are people who don't want to go out of their way because they think the disease isn't that bad. There are people who worry that the vaccine is going to make them infertile. There are people who worry that the disease is going to affect their brains. There are people who worry that the vaccine is going to give them cancer. These are all different things. There are people who have religious problems, right? There are people who say, they have concerns because they'll say that the vaccine was made using the fetal cells, the fetal cell lines from abortions that happened in the 1960s, which is true of some vaccines in the United States, the measles vaccine, for example, and they might have a religious concern about that. So, there's all different kinds of reasons people might have concerns about vaccines. You need to really do the work to understand not just what they tell you, but what others in their community tell you and what researchers who have been studying that group tell you, and think about their history. I don't know how familiar you guys are with US history, but one of the things that African Americans in the United States will often talk about is Tuskegee experiments. Yeah. These were experiments in the 40s through the 60s or so. Basically, the United States CDC, they didn't inject anything improperly into people, but what they did was all these men who had syphilis, they pretended like they were treating them and they weren't treating them at all. Instead, they were just observing them to see what happens. And so they let these people, they didn't, some people think they injected them with syphilis. They didn't. And some people think that they gave them bad treatments and they didn't. They just didn't treat them at all. But still, that was a horribly unethical thing to do. And that's just one example. There's lots of examples in the US of Black Americans being mistreated by the system. So it's totally reasonable for a lot of Black Americans in the United States not to trust a medical system that has already mistreated them in so many ways. Yeah, I'm sorry, that was a very long-winded answer, but sorry.
Oh yeah, that went really way beyond the time. But there is also this pertinent question regarding reporting vaccine hesitancy and the other issues, which is who determines who is legitimate, the legitimate voices to include in stories. And in an attempt to only talk to the right voices, and what happens to, it seems that we stand the risk of reinforcing the sentiment about that those that promote vaccine hesitancy do call, like the mainstream media does not want you to be aware of what is going on. So that is why they are not, they don't want you to actually know what it is. And they also have access to the internet. Many posts on social media that encourages vaccine hesitancy do get viral easily, while those that are always promoting facts may drag along. So how do we deal with this, ensuring that we are not ostracizing or we are not standing as the only people that can convey the truth?
I'm sorry, so I didn't, I have a fan back here I should have turned off. What was the actual question at the end? I heard most of what you said, but what was the key question?
Yeah, the key question is this: how do we decide who is legitimate without feeding the stereotype of journalists also be working with
Gotcha. Now I understand. Yes. That's a really good question, and it's hard. And I will tell you, the United States, we have that problem a lot. You have, for example, I've mentioned several times that people who voted for Trump have a lot of distrust about the vaccine. They also have a lot of distrust of the media, and they think the media is in cahoots with them. I would say that the most important thing you can do there, you need to talk to trusted messengers. You need to talk to people who normally might be, even, what's the word? Not aggressive, people who might be normally hostile to the media, who might be the ones saying, oh, the media this, the media that. But if you can find someone who's saying that, who also believes the science and people trust, that's where that diverse sources comes in. When I mentioned talking to diverse sources, if I was writing an article about the vaccine and I did not talk ever to anyone in the Black community, if I didn't reach out to Black doctors or Black researchers, why would any Black person reading my story trust me? They're not going to. So the sourcing is where it becomes really important there. You need to talk to the actual experts who study things. But you also need to find people, look for people who are within the government. This especially becomes a problem in the government if there's partisanship. And one thing that they'll do in the United States is there are Republicans who voted for Trump and supported Trump in the United States who are promoting vaccines. Talk to them and get their, that's a very US centric example, but it's all going to come down to your sourcing. And you have to think, who are the people that you're writing to going to trust? And you need to talk to people that they are going to trust. And that may be people that you have concerns about. So you want to make sure you're choosing carefully. Also keep in mind, there are some people, if the only person they're going to trust is someone who's spouting conspiracy theories, you can't reach that person. There's always going to be some people you can't reach. So you can't expand your net so wide that you're trying to reach every person. I used to teach high school, and something you learn very quickly when you're a teacher, you can't save every kid. Okay. And it's the same way as a journalist. You can't save every person, but you do the best you can. You think outside the box. Ask someone who is from a different group than you, whether it's a cultural group, a religious group, whatever. Ask them to read your story and say, who have I left out? Who am I not thinking of? Okay. And try and reach out to those groups.
Yes. And I also had a very interesting perspective and understanding of how it seems to be that we may be misunderstanding the people that we think are hesitating or reluctant to take these vaccines. Like I said before we went live, I got my own first shot today. And at the facility, I was interacting with people about their concerns about why they've not gotten the vaccines since. And I was actually being exposed to issues that no one was actually thinking about. Somebody was talking about how it was difficult to register, how they did not know which facilities were providing this vaccination, even the logistics. You have to stay on the queue for long hours. Some people are always reluctant to actually stay that long waiting for things. And these people will just be bundled up under the umbrella body of people that are reluctant or unwilling to take the vaccine. So how will you access the coverage of vaccine hesitancy? Do you think journalists have been able to do a terrific job? And what do you think journalists are not still getting right?
I think, everybody knows, everyone who's a journalist knows that journalism works on trust, right? Everything that you do is based on trust. You're trying to establish trust with your readers. You have to establish trust with your sources. And when you're interviewing, sort of man on the street kind of thing, where you're talking to people, you need to make sure that they believe you, that you really want to represent them truly, that you're not using them to make a point that you want to make. So I think a lot of that is going to rely, that's not a science question, that's a person and journalist question, right? That comes down to who you are as an interviewer and your ability to create rapport with those that you're talking to, and create trust with them. And that's going to vary a lot. It's hard for me to give sort of generalized advice because it's going to depend on who you are, on who they are, on where you are, the context. On, if you're interviewing someone and there's like 3 guys with AK-47s like watching over everybody, they might feel more on edge and anxious, right? Maybe you initially talk to them and then you follow up with them later, right? So it's going to depend on the situation. It's hard for me to give sort of generalized advice on that.
Yeah,
I don't know if that helps or not.
Yeah, I understand. Then we've always had, I was quite happy you also mentioned it in your presentation. We've always had vaccine hesitancy is not something that is new. But what do you think has been different regarding vaccine hesitancy in the COVID-19 pandemic? What took
different compared to other vaccines, or?
Yeah, what took vaccine hesitancy to the mainstream?
What makes COVID-19 different in terms of the vaccine issues, the biggest thing is it's brand new. People are going to feel like, wow, how did we get a vaccine that fast? It usually takes years to get a vaccine. So one thing journalists really need to be able to do is explain, how were these vaccines made so quickly? I have an article on this, but there's different articles that are out there. And that's not true. Most of my knowledge for the vaccines is related to the 3 vaccines authorized in the United States, and the AstraZeneca vaccine. But there's, oh gosh, how many vaccines do we have now? I don't even know, 10 or 12. There's quite a few out there that COVAX is doing. So, people are going to want to understand how, how did they make it this fast when they can't make it for others? And they also need to understand that different pathogens are difficult to, like, for example, we've been trying to create a vaccine for HIV for, oh my gosh, since the 80s, right? Like since 1983. And the HIV virus is a really difficult virus to make a vaccine for lots of reasons. So people need to understand that it's not about will, like political will or money. It is sometimes it's a matter of money, but it's also about like the actual pathogen and what is science, what is possible in science. The mRNA vaccines, for example, the technology for doing that has existed for like 10 years. It hadn't been used before because it was untested and it's really expensive and you had to have a good reason. We didn't have a pathogen that was worth investing in that we thought a lot of people would get the vaccine for. Well, now we do. So we had a reason to test it and discover that it works. Another thing that's different for COVID-19 is there's constant uncertainty right now. We don't know what's happening next. We don't know when the next variant is coming. We don't know how it's going to affect people. We don't know, sometimes here in the United States, the CDC has flip-flopped on some of their guidance and, people don't know what they should do or what's the safest thing or not the safest. And people are tired. They're like, I don't want to stay home anymore. I don't want to wear a mask anymore. I'm tired of this. I just want to live my life. Now, some of the countries, I don't know where everyone is from, but some of you have come from countries where perhaps you had an Ebola outbreak, or perhaps you had a lot of measles already, like communities have already had outbreaks. So they know what the fear of a disease feels like, right? However, COVID-19 is global. It's the entire world. And we all don't know what's going to happen next. That level of uncertainty that is sustained for a long period of time, okay, to be real blunt, it fucks with your head. Okay, I mean, it's, sorry to use that, but I mean, like, it messes with your head. Okay, it's hard to think rationally when you are under that level of anxiety and uncertainty and you don't know when it's going to change. And that's true across, that's true no matter what country you're in. That's not, I mean, high income, low income, middle income, black, white, red, yellow, whatever. I mean, we're all going through that right now. And I think that's the biggest thing that makes the difference.
Then you also, in your presentation, I also caught something about how we need to actually rethink how fact-checking is done. And I think it's a really, really critical moment and critical issue, because when fact-checking is done, what is usually done is the major fact-checking organizations, they all use a similar approach. They will mention the statement or the assumption that they want to fact check, and they would now present what they believe, what they've found out to be the truth. But like you said, just mentioning this kind of this wrong information, this misinformation, also provides some level of authorization or credence to them. And so which brings fact checkers into presents them with a very serious dilemma. Do you think fact checkers are also promoting misinformation? And in the long term, how do you think how fact checking was handled in COVID-19 would impact future pandemics and future science issues?
That's a really challenging question. And that's a question that academics are going to be debating for years. That falls into that area of epistemology, right? How do we know what we know and why do we believe what we know? And the problem is the world is not used to watching science happen this up close. I don't know if you guys know this expression, but in the United States, they talk about politics as how the sausage is made, right? You don't want to ever, you want to eat the hot dog, but you don't ever want to see how that hot dog is made, right? Because that's not fun. And I feel like right now we're all seeing how the sausage is made with science. Most people are used to hearing the end advice at the bottom, and maybe they see the advice change once or twice, but for the most part, it's, science feels kind of static to them. As science journalists, we know science is constantly changing, right? The whole process of science is this imperfect, I imagine a bunch of scientists with like half blindfolds, like crawling toward the oasis trying to find the truth, and they're falling over things along the way and they go the wrong direction, and the public is not used to seeing that. They're not used to seeing all those missteps along the way. And I think someone asked me almost a year ago what I thought the most challenging thing was about reporting in the pandemic. And I said, trying to explain how science works. It's really difficult to explain to people how the actual science that they know is not how science actually works, right? And so trying as best you can to explain that without weighing things down, I think can give people a sense of comfort. I don't know if it's fair to say that fact checkers have made things worse. I think fact checkers have been caught in a rock and a hard place. They couldn't win, right? One of the examples here, there was a big myth about Bill Gates putting 5G chips in the vaccine. Okay, that sounds really crazy, but there were a lot of people who believed it. So do you cover the super crazy thing because a lot of people believe it? Or is it so crazy that you don't cover it? I don't know the right answer to that, honestly. I don't. And I don't know if there are quote unquote right answers. And the WHO, they talked about the infodemic that we have, right? We have the pandemic, but we also have the infodemic, and it's serious. There's a lot of disinformation agents out there who are promoting false information, and they have an agenda. And we're having to fight that at the same time that we're fighting the actual virus. There's not really a playbook for this. A lot of this, we're making it up as we go along. And I
think I agree with you.
Those are good questions, but I don't know if we're going to know the answers for a long time.
That's also another pertinent question that I think I would like your take on. How do you cover and how do you report highly influential individuals that are also the major drivers of misinformation? So influential people that are actually the ones. Yeah. So what is your strategy?
It depends on why they're influential and in what circles. I said before that shaming doesn't work, and shaming does not work for talking to everyday people. I do think that shaming and marginalizing highly influential disinformation agents can be valuable. You want to marginalize them. You want them to sound like the crazy crank that they are. And that can be challenging. Here in the United States, we've got a lot of people on Fox News who are just spouting crazy talk. And Fox News requires everybody to either get vaccines or to be tested regularly. So they're making stuff up because they're probably vaccinated. All you can do is call it out, but don't harp on it. Try to, you have to strike this balance between striking down what that is and marginalizing them, and then focusing your energies on getting the accurate information out there. And I don't know what that perfect balance is. By the way, I looked at the two, there was two questions up here.
Yeah. I'm actually driving, I'm going towards them, gravitating.
Oh, okay.
Yeah. So the first question that I would like to take from here is, I think you mentioned about choosing photos to use for pictures. As a journalist myself, many times I also find myself saddled with the task of taking these pictures. And so this question is quite relatable. So, in many vaccination centers, taking photos are prohibited. How do you think we can get visual materials?
I'm going to share my screen here with, okay, you're going to have to forgive whatever comes up here. There we go. This is US centric. However, some of these might be valuable for you. The American Academy of Pediatrics in the United States partnered with Self Magazine, a magazine here, to create accurate vaccine photos. Now, these vaccines are not the COVID vaccine specifically, but they do show images of people getting the vaccine, and there's a diversity of people here. And they don't have masks, if that's relevant. Some places have masks, some don't. But
sorry, Tara, for quality you short. I'm not seeing anything from my hand.
What's that?
Can you reshare the screen?
Oh, I thought I was sharing the screen. Is it not sharing it?
It's still saying Tara started screen sharing, but we're not seeing anything.
So weird. Okay, it says I'm screen sharing. Okay, let me try this again. I'm sorry. Okay, let me just choose desktop and that will work. Can you see it now?
Yes.
Okay, so I'll put this link into the chat. but these are all free. Anyone can use these from any country. There's no charge to use these. So these are some images that you can use. There's a fairly diverse group in here of people. Another thing you can do, let me put that in before I forget in the chat, that link, is talk to people after they leave the vaccination center and do a portrait of them, or have them showing off their Band-Aid, away where they're away from the actual center. You could show from a distance, possibly the lines. It depends on where they, I don't know where they cut you off on the photos, but if you are able to be far enough away that you can catch the line of people lining up, that's an option. You kind of have to get creative. There's not a lot of good answers. Using stock photos of just the vaccine itself, or going and talking to people, like I said, and getting a portrait of them and them talking about being vaccinated. So those are some options.
Yeah, thank you very much. Then, like you mentioned, in many places, vaccine hesitancy, vaccine reporting in general has become a political issue. But out beyond the United States, where we still have fabrics of democracy in place, in other countries where we have where political reporting an issue that is not well aligned with some interest groups can actually get journalists killed. So, so this person is asking, what do you think of writing several pieces all under pen names to hide the identity?
I think it's going to do, I don't think it's unethical at all. I think it can be very ethical. I think it depends on the circumstances. If writing under your own name could put you in danger, but you can make a name for yourself under the pen name, right? If the pen name becomes a trusted name, I think that's perfectly valid, because the goal here is trust. And you can't, well, part of the goal is trust. The other goal is staying safe. If you're not safe, you can't report on this. So I think there are definitely situations where using pen names can be necessary and ethical. It's really going to depend on the local circumstances. And there's too much differences in the different people who are there for me to really speak in specifics on that, but I think there's nothing unethical about it for sure.
Yeah, there's also this really good question that I think, so it reads those, it is true that many people sound anti-vaccine, but eagerly get vaccinated. How can we detect the mismatch between their words and deeds?
That's hard. It is true. In fact, there was a story here in the US of people who were trying to get vaccinated they would go to the hospital and say, can you put me in the back room? I don't want anybody to see me getting the vaccine, right? Because they didn't want anyone to see them getting it, because they didn't want anyone to see it. So that definitely can be true. And I mentioned before, some people on Fox News, there's a commentator here called Tucker Carlson. I don't know for a fact that he's vaccinated, but he probably is. And yet he talks against the vaccine all the time. This is going to come down to your skills as a journalist. This is not about the science part. This is about the people part and the interviewing part and the journalism part. Your spidey sense, right? There's all kinds of reporting situations where people are not truthful with us, and we have to kind of, try and pick out where they're not being truthful, or talk to their friends or talk to their family. So I don't have an easy answer for it, just to be aware of it and just kind of, you do your journalism, you do your sleuthing, and recognize that you're not always going to be able to know, you're going to get duped. We don't have mind reading skills. So you do the best that you can. I think simply being aware that those people exist is helpful. Like that alone will kind of put you on guard a bit.
Yeah, so. Then I also have this question for you. What do you think about, you mentioned it, do you think, talking about how poor access to the vaccines can be misread as vaccine hesitancy in some places? And which begs the question, can we say that we are still seeing the true status of vaccine hesitancy, or we need to just chill a bit until vaccines are available everywhere?
I didn't hear the last part. Say that last part again.
So the question is this, do you think we are getting true picture of vaccine hesitancy in our stories, or do you think we should just chill a bit until vaccine access has significantly improved everywhere?
Yeah, I think vaccine hesitancy and vaccine access intersect a lot. And I think they get messy. And some of the examples I've given already are good examples of that. If people have good reason not to trust the medical system, that could make them hesitant. But not having access to a person that they trust, that's lack of access, right? And those go hand in hand. So I think it's important to be aware of those and pick those apart and try and be honest about them and recognize that, you know, sometimes it's hesitancy, sometimes it's access, sometimes it's a mixture of both, and they're interrelated, and you have to acknowledge that. So I don't think there's I keep saying there's not a simple answer to this, but you know, that's unfortunately that's the case. And when we talk about vaccines, we're talking about the intersection of hard science with psychological science and social science and faith and people's emotions and family and relationships. You know, there's a lot of it, you know, we all know that relationships are messy, and that's when you're talking about vaccines and someone, you know, a ostensibly healthy person getting a pharmaceutical product when they're not sick yet, like that kind, you know, that's kind of the opposite of what we're used to. Usually you get sick, then you get a pharmaceutical product. Vaccines work the opposite. So there's all kinds of ways in which that is sort of contrary to what makes sense to us on a visceral level.
Then for maybe suggestions of new insights regarding what you think science journalists can still work on, are there issue areas that you think people are not looking, journalists are not looking at for story leads yet that you can recommend?
Recommend what was the last part? Sorry, I need to turn that
story
off.
leads, okay, angles that may be largely ignored that you consider to be potentials for stories. Did you get that?
Sorry. I'm missing it. Hold on a second.
Okay.
There's a fan on in my room, and it's making it hard for me to distinguish what you're saying, and so I'm having trouble hearing it.
Okay, let me repeat the question. So the question is this: are there issues regarding the topic of discussion today that you think journalists that is still being underreported, that journalists can actually focus on? Yeah. Okay.
Yes. I do think there's I mean, it's hard to cover any issue completely. So I do think there are some things getting underreported. An example of something I think is getting underreported in the United States, the Moderna vaccine and also the Pfizer vaccine, but to a greater extent, the Moderna vaccine has been linked to myocarditis, which is an inflammation of the heart in young men. So men, you know, males about ages 15 to 24. It's still very unusual. It's still a low risk, but there is a risk of an inflammation, you know, and people usually recover, fully from it. But there is a definite link between the COVID-19 mRNA vaccine, especially Moderna, and myocarditis or pericarditis. One of the things that I think is not being covered here are the people who are getting myocarditis and then having to be hospitalized, and then they recover, but they've got a bunch of hospital bills. And the United States hospital bills get really expensive really fast. Are they getting properly reimbursed for that by the government? I don't know if they are. And that's an example. Is anyone talking about how people are getting reimbursed for the actual effects that do happen that require treatment? So that's one example. But I do think, I mean, this is such a huge and complex issue. It's not ever going to be fully covered. One of the ways that I try to find those undercovered stories, I do a lot of crowdsourcing. I ask people on Twitter, I ask my friends on Facebook, you know, what are you hearing? What are you seeing? You know, what questions do you have? You know, so there's always going to be undercovered issues. I think for the most part, when I look at the big picture, you know, I've been reporting on vaccines for 11 years. So I've seen lots of bad reporting on vaccines. I've been impressed with how much journalists as a whole across the world have been working hard to do good quality reporting. There's been missteps, but there's a genuine effort to do a good job of reporting, and that's good. I'm really happy to see that.
Yeah, so, and as we wrap up, I would like, we did not get to really talk about AHCJ, and what has been the COVID-19 experience for the Association of Healthcare Journalists in general? And going forward, how do you think the activities of the association will be shaped by future health issues?
Wow. Well, I mean, in terms of logistics, we're challenged right now, just trying to figure out when we can hold our conference. That's been part of it. But I think the interconnectedness of the healthcare system, a lot of times healthcare journalists are very isolated, like this person covers policy and this person covers vaccines and this person covers like patient safety and this person whereas with the pandemic, it's everything, right? It's business, it's education, it's families, it's, it touches every aspect of life. So recognizing the interconnectedness of that, I think is important, and it might cause a lot of members to go attend sessions and seek out learning opportunities in areas that they don't normally cover. I've had to cover recently, I covered the parents who are mad about schools not allowing masks and wanting to require masks in school, or not wanting to require masks, like both sides of that. And I don't cover law at all, but I've had to learn words like injunction and a stay and, all these legal terms. So I think there's a lot of that going on. And I will say also, I don't know if your members are aware of this, but the Association of Healthcare Journalists, the resources that we have on coronavirus, on the COVID-19, they are free for anyone. So you can go to the website and check out all of the resources that are available there. We have tip sheets on vaccines and explanation pieces. And so I encourage everybody to check out those resources because they can be really helpful. And one question I just saw where someone asked about sending your piece to your sources to have a look before publishing them. I do not do that. That is usually considered, like most publications will not allow that. What I will do though, is if I'm talking to a really sensitive source and they're concerned about what they might have said, I might take one quote that they said and say, this is the quote I'm going to use. Or I might, if there's a really complex scientific topic and I'm trying to explain it, I want to make sure I got the science right, I might take that passage and send it to the scientist and say, did I accurately describe this? So.
Yeah, thank you very much for taking that.
One question. One person asked, can you become a science journalist without having a solid science background or degree?
Yeah,
that's me. I don't have a biology degree. I have an English degree and a journalism degree. So yes, you can. You just have to put in a lot of work.
Okay, thank you very much. And I've also put the link to Association of Healthcare Journalists websites in the chat box. Please check it out also, their resources. And we've already gone way beyond the time.
I saw that we were past time.
So that's why I'm trying to wrap up. So thank you very much, Tara. I really enjoyed this session. It's quite enlightening, and you've been able to shed light on very key issues. And even before we started this session, I knew that some questions may not be answered, and we were able to agree on the various shortcomings and limitations, and what we continually need to do as healthcare journalists. And it became obvious at the outset of the pandemic that even many healthcare journalists did not know that not all vaccines prevent new infections. And so it simply means that everybody is learning about public health, about immunology, about viruses, about diseases, almost at the same time, unlike veterans and people that have been doing it on a daily basis before. And also the pandemic has actually shown the need for robust and improved science journalism ecosystem, and there would always be a new pandemic. The next disease is sure. The only difference is we don't know when it's going to happen. So any knowledge acquired during this pandemic is not a waste. So please, as journalists in different parts of the world, continually improve your skills and expand your body of knowledge. So I also want to appreciate the leadership of the Association of Healthcare Journalists for partnering with us to facilitate this webinar. They were quite instrumental in ensuring that Tara is our facilitator today. So I say thank you. And we'll also be partnering with the association for our webinar next week also. So I'm really, really grateful, and I look forward to that webinar, which also promises to be quite eye-opening. And so for more information on the AHCJ Global Health Crisis Reporting Forum, I encourage you to check out www.icfj.org. And I also encourage you to join our community on Facebook, which is the go to Facebook and search for ICFJ Global Health Crisis Reporting Forum, be part of our community. And I also recommend resources that are available on the HygieNet website. So please visit www.hygienet.org. And thank you. Stay safe. If you've not gotten vaccinated, ensure you get your vaccine. And I say have a great day.